Welcome back to Champion News Talk Radio, brought to you by championnews.net. This is our very special program with our founder, Jack Roser, and C. Stephen Tucker.
I want to hear more from Mr. Tucker about single payer.
Single payer.
Who is single payer? Is this some benevolent person that's going to...
George Soros going to pay everybody's health care? Is he the single payer?
Well, the statists in D.C. always think they're benevolent, and they always think they do the right thing. Anyone who is an advocate of single payer has to, number one, trust that the government will spend their money better than they can spend.
No, wait a minute. You're telling me that the government is a single payer?
Oh, this is what would happen.
No, wait, if it's a single payer, that means I don't have to pay.
Oh, you do have to pay. And then they're going to take your money, and they're going to put it in a lockbox like they did with Social Security.
Well,
so that's there for you.
What you're telling me is that it'll be a tax buried among everything else in the income tax.
Absolutely.
Is where I'm going to pay.
You will pay higher
taxes. So
taxes.
that they can pay for whatever care anybody wants. How about the people that don't pay an income tax?
Oh, you still get to subsidize them.
So the people who pay the income tax are going to be subsidizing both halves.
Single payer would be the largest tax increase in U.S. history, and it would be redistribution of wealth like we have never seen it in this country before.
So we're hearing socialized medicine.
You know, people who came to this country from all over because of the freedom in it. I think I see the possibility that the educated and the rich are going to flee this country.
Yeah.
Well, where are they going to go?
Well, there's a lot of places where the idiots don't have a government system and hasn't yet gotten to the inevitable end of something run like that.
But in reality, most of the wealthy in other countries come here for their health care because we do not have a socialized medicine system. But we are rapidly on our way there because of Thursday morning's decision.
Steve, really, do you... okay, you know what? This is horrible. And I know you have read a lot of the Supreme Court rulings.
193 pages. Thank you.
Steve, what are Americans to do? I mean, is this the path we're on? Because this says more about us as a people and as a country than anything. This election, who we elect, says more about who we are as Americans and who America is.
No, wait a minute. Wait, I'm not through with this single payer thing.
Yeah.
Single payer is what we've got in our school system, isn't it?
You're exactly right.
Our kids are being educated by bureaucrats. How's that working out?
Horribly.
I'm an employer, and 3/4 of the people that apply for a job with us cannot do 6th grade arithmetic. I know that. That's fact. I know that coming out of our high schools, only 4%, in a big district that I live in, only 4% are qualified to go to a 2-year college without remedial training.
It's pathetic.
Our K-12 system absolutely, at very high cost, it absolutely stinks compared to the other countries like Korea, England, throw in Germany, of course, and France. Some 25 of the other industrial countries, our children get lower grades than those others. We got a really lousy, stinking poor, high-cost, single-payer education system in the K-12. Why would anybody want to duplicate that with our medical care?
Nobody sane would. And that's precisely what we would be doing with health care if we implemented a single-payer system. But this is their goal. President Obama promised the SEIU that this is our goal. We won't get there right away, but we're going to get there. You do that by bankrupting the health insurance industry, which those two aforementioned clauses that are now in force and not stopped by the Supreme Court will do in a short period of time. And then Barack Obama can say, I tried to work with the insurance companies, I tried to work with Congress, but they were filibustering me. Now let's do single payer.
You know, when Obama suggested this kind of a plan some 3 years ago, passed it through, there were a lot of things that were going on that were going to solve the care so that the people retain control of it. One of them, in the 20 different ways I figured you could get medical care without Obama, one of them is business medical saving accounts.
Absolutely right.
Is that going away?
The health savings accounts are a beautiful concept.
Are they going to go away?
They will not go away. Unless the insurance companies are bankrupted, then no one's there to insure
Then
it.
they'll be gone.
But Senator Bill Archer, a Republican out of Texas, came up with that idea. And one of the first high-profile people to ever implement it was John Mackey. And John Mackey is the CEO of Whole Foods. And he took his health insurance plan, which was costing him a fortune for all of his employees, and he switched it, dumped it, replaced it with an HSA qualified plan. Because his employees lost their $10 copay for everything, they picketed outside of his office. And John Stossel, ABC News, put a video camera on all of them, and they were calling him all sorts of names, et cetera, et cetera. 4 years later, Stossel gets his own show on Fox Business. He invites Mackey's employees back in the audience and asks them, "What do you think of your CEO now?" "I love my CEO." And they said, "Why do you love Mr. Mackey now?" Because see, what Mackey did is he took all the money he was paying for an expensive low copay plan and put that money into health savings accounts, medical IRAs for every employee, even the ones wrapping fish
Now
for $7.
people had to pay out of their own fund.
And guess what they're doing? Now they call if they need a physical. "Yes, doctor's office, what do you charge for a physical?" "We don't know. Do you have insurance?" "Yes, I do." "What's your cost?" "We have no idea." Click, they call the next person. Why do they want to know what it costs? Because whatever they don't spend is theirs to keep.
Oh gosh, that sounds like individual responsibility.
Oh, don't say that.
Concept.
Oh, you racist.
And this thing has cut off the growth of a very good idea like that.
Of course
It's
it
been
has.
cut off by the looming federal tyrant of a single payer.
That's right.
Do we have solutions?
We have so many solutions. One, Jack touched on, tort reform. It must be implemented, reasonable medical malpractice reform. Otherwise, we will never lower health insurance costs. We'll never lower medical care costs.
It's been estimated that that would knock down the cost of medical care by about a third.
You don't even have to estimate. Just look at Texas. They did it. I love selling health insurance in Texas because it's cheaper than any place else because they have tort reform.
Well, you know what, Steve? There are other things. Tort reform, give me one more. We have 3 seconds.
Repeal the McCarran-Ferguson Act of 1945. Allow health insurance companies to sell their products across all state lines so there are no monopolies created. Repeal some of the onerous mandates.